Working in the labor and delivery department, I have found many parents are nervous about providing some basic newborn care. New parents, as well as experienced parents, sometimes just need some reassurance to know that they are providing appropriate care to their new little ones. Today I will discuss some techniques and tips on diapering, burping, sleep safety, and swaddling technique. I'll begin by talking about diapering. Diapering sounds like an easy task, but when you have a crying, screaming newborn, it can become a challenge. First of all, you want to make sure that you have all of your supplies necessary at hand, such as diapers, wipes, diaper cream if necessary. You also want to have a toy or a rattle or something to provide a distraction. If you're not using a changing table, you'll want to have a blanket or something else to lay underneath the baby to prevent any accidents. Now I'll show you how to do a diaper change. I personally always have the other diaper ready and place it underneath the old diaper because I have been peed on numerous times. I'm going to get your wipe ready. And you always want to wipe front to back to prevent any type of infection or spreading any germs. You always want to inspect the bottom and check for any type of redness or excoriation on the bottom to make sure that you don't need to use diaper cream. If there is redness, you'll want to put a thin layer on to help prevent it from getting worse, or you can just use Vaseline sometimes or other creams just to prevent it from getting red to begin with. Once you've applied that, you can take away the old diaper and put the new one on. You want to make sure to have the diaper snugly fit, not too tight and not too loose. If it's too loose, sometimes pee or poop will get all over the place. Now, I'll talk about burping. Frequently burping the baby will help prevent any type of upset stomach or buildup of gas. If you're breastfeeding, burping is not as necessary because they don't get as much air, but you still want to burp in between switching sides. If you're formula feeding, you want to try to stop and burp the infant after they've drank about half of an ounce. Doing so just helps keep your baby happy. Now I will talk about sleep safety and swaddling technique. In order to prevent sudden infant death syndrome, you want to follow a few basic sleep safety rules. You always want to place the infant on its back when sleeping in the crib, and you always want to have the infant sleep in the crib. You don't want to have any bumper pads. You don't want to have any pillows, any extra fluffy blankets, no stuffed animals, nothing else in the crib. You just want to have the sheets and the infant. It's also recommended just to have enough clothes on the infant to keep them warm, so you don't even have to use a blanket. During the daytime, you want to do tummy time, and that's about the only time you want them on their stomach is when they're awake, and this helps build the muscles in their chest and helps them move and helps them prevent SIDS. Now I'll talk about how to swaddle the infant. You take a receiving blanket and you want to take one of the corners and you fold it down. You want to place the baby's shoulders at the top of the blanket. You want to make sure that the infant's hands are up to their chest. You don't want to swaddle them down. This baby's arms doesn't bend, so I'm going to swaddle it with them up. So once the baby's laying there, you want to take one corner of the blanket, fold it over, and wrap it underneath them. Then you take the bottom, put it underneath them as well, and then you take the other side, fold it over, and wrap it around them. And you have a nice little baby burrito. So today I have discussed diapering, burping, sleep safety, and swaddling. Having a new infant can be a scary chapter in anyone's life, and I hope that these tips have helped you feel more comfortable in providing care to your newborn.